My name is Bill Grant. In addition to chairing the AIM Healthcare Cost and Policy Committee, I am the CFO for Cummings Properties. Today, Cummings' 500 employees manage approximately 9 million square feet of commercial real estate, which is the home for some 1,500 clients just north of Boston. In addition, we own 2 assisted living facilities with over 400 apartments, as well as Cummings School of Veterinary Medicine out in Grafton. As everyone knows, the healthcare system is extremely complicated. We welcome the committee's efforts to begin sorting out these complex issues. In my opinion, for employers and consumers to begin understanding the various components of healthcare, it is paramount users, regardless of the plan size, have timely access and tools available which will allow them to take the large amounts of data and make it into useful information. Although we are creatures of habit and inherently resist change, in the area of wellness initiatives, it is here that every company and every employee can have an impact on healthcare costs. Since we began our incentive program some 5 years ago, we have now a 75% participation level. We've been able to hold premiums level for the 4th year in a row. We have engaged a tier program because we are firm believers in choice. And we are hopefully this year going to be able to get to 100%. And in addition to the impact the wellness programs have on insurance premiums, there are many costs which are ultimately affected. Some are measurable, while others are not. Studies have shown that workers' comp costs can be as much as 20% higher and take people 3 times as long to heal, in addition to productivity being some 5% off during the work week for people who have untreated health-related issues, not to mention the impact on their families and their personal lives. We strongly encourage everyone to initiate an incentive-based program which will help identify the areas that company needs to focus on. Thank you. The 75% has come over 5 years. It has been, early on, it was the health fairs, come have your blood pressure and things of that nature. We gave away Red Sox tickets. We had a very low participation. So then we stepped it up and started paying people $200 if they went and had a physical every year. The thinking was that if they were standing in front of their physician and one of their 5 points was out of line, that we had a better chance of having some success. And that got us up to about a 25% participation. So then we implemented a discount on premiums for those that do participate, which is on a family plan is somewhere in the neighborhood of $2,000 for a year. So someone had made a point earlier about people who work paycheck to paycheck. We have a lot of people who are in that arena in our 500 employees. So that got their attention. We had to educate their spouses because we'll be honest, most times it's your significant other that is making those decisions and just sort of helping you through that. And when tiered products became available, we last year introduced that. We had sort of a evenly divided between tier 1, 2, and 3. We were able to work with our insurance company to determine that there were options for people. So we've seen a big shift from people away from tier 3 into tier 2, 1 and 2. So I think between all of them, we have been able to, the results are we're now in our 4th year without having to increase the premiums for those people who have participated. And the company pays about 70% of the premium and the employee pays the balance. In regard to the data, it's always to me interesting. One of the things that I think works against the consumer and the employer is a 1-year contract. We've just negotiated our 2014 numbers, which was based on data which was basically through May. And when you look out that this is now going to be in effect for pricing all the way through 2014 and really into the first 2 or 3 months into 2015, it's extremely difficult, in my opinion, if you're the insurer, to really want to roll the dice. So we're an advocate of, is there a way to have multi-year contracts to help people not have to go through that daunting task every year? We insure roughly 600 lives. We're not completely self-rated. There's still a component of the community rating in there. But we use the data on paid claims, which again, the timeliness and transparency of it, we look at a lot to see what trends, if any, that are developing. In our wellness program, we know 4 of our measures, which is blood pressure, cholesterol, sugar, body weight mass, and whether you use tobacco products, we're in great shape against national average. Cholesterol, we're terrible. So we're going to focus on that. So that type of data has helped us and how we look at it.